to go. That's the magic word. Prevention. If we prevent, which are mostly preventable, and I'm talking about not just the medication and so on, but what to eat, nutrition. What's how to basically count your calories, how to pick up the healthy stuff from, when you shop. Because you are what you eat, you are what you drink, you are what you put in the system. You put in good stuff, you get good performance, just like the car. And if it happens vice versa, then certainly it will also lead to adverse things. Try to get rid of bad habits. And we're going to have actually on the website a webinar, for those who enroll into this program, that they can actually log on and they can have a communication, one-on-one. During this webinar, so we can ask questions, whatever they happen to be, only through the technology anywhere, over here or anywhere around that they can get and see us online. One more thing, we're going to have a de-stress corner, where somebody, Doc, what happens? I wake up 3 o'clock in the morning on a Saturday and I feel bad, I feel down, I feel depressed. I'm so stressed out. What do? You log on, Brooksville Cardiology, and we're going to have Comedy Central. And we're going to have jokes and laughter and cartoons and, things about motivational speeches and things to pump up everybody so that you can, okay, now I'm okay now, after this. And we'll try to be innovative. Bob, we talked to Bob Benrod about this, and we have the radio show with Linda Shields from North Carolina. And we can do a lot of creative things to get this jolt of positive energy into our patients, and hopefully it'll be contagious enough to pass on to others and so on. Because now you hear nothing except bad news, except this thing's going to go up, all these things, and people are just tremulous and nervous and so on. We don't believe in manipulating the fear factor in Brooksville Cardiology. We actually trying to reverse that fear, and this and that. You only fear of one, your creator, nobody else. And that should be your main goal of life, to do everything that you can to do the right thing, no matter where you are, no matter what port, because that's good for your heart. Very good. Fighting fraud is good for your heart. Doing just like exercise and eating right and so on and so forth. So the whole entire concept of getting someone really in a good shape, 21st century with all the stresses and so on, we're going to use the technology actually to get rid of that, to reverse the stress, to uplift people and give them hope. I'm going to stop here, and if there's any questions at all, I'll be more than happy to answer. Thank you so much for your attention. Yes, sir.
Yeah, how much is the package?
Okay. Look at this. Where are you from?
The Bronx. The Bronx.
Okay. Anybody from the Bronx? Up on the hill? That's the Brooklyn. Okay. That's the drive-by. If you go by and then, get down. Everybody's like, get down. Somebody's shooting somebody. This is okay for the age, like I said, we cannot enroll, less between 30 to 65. But if you're asking for somebody in that age group, because anything 65 and above, that's Medicare, and we cannot, touch that. That's if they want, that they already have, different setting. It's only $200 a month for all this stuff. So for someone to look around, like I said, for one ER visit, that's a month, 1 year, for our health maintenance. If you go, for any other testing at all, we can go one-on-one and you can compare the numbers and you'll be amazed. If you all did this package, and by the way, we still have some, like flu shots, and will be all year-round enrollment. So if you see somebody who's struggling, with business, struggling, a son or a grandson, a neighbor, or so on and so forth, tell them there's hope, there's something nice. And I think we heard about it in Brooksville Cardiology, and we have it on the radio ad. So every Wednesday morning from 9 to 10 and Friday morning 9 to 10, you can see the staff ask questions. And if you feel enlightened, and this presentation hopefully will be on YouTube, so it'll be seen by 6 billion, audience around the globe. Anybody who feels like this is, hey, I think it's clicking here with me, then by all means, get their name out, and even if you hear of somebody or whatever, please stop by. There's free refreshments every Wednesday and Friday. And once we get, this concept into people's mind, and they become really, really attached to it, and they become fully convinced that this is the right thing for them. We're not pushing anything on anybody. We're not selling anything to anybody, but we're just basically informing you and everybody who is looking for a solution. We put 4 years into this of looking things, calculating, looking at what's out there, with the options. Right now, things are getting tough, and they're probably going to get tougher. And then the premium is going to go higher, this, and that. This is a different approach altogether, and that hopefully will give people hope. This is for the self-pay or those who are paying too much premiums, and they can't afford it, and they want relief. The relief is here, and I didn't want to brag about it, but 60 to 70% of my patients get free samples. So in there, if it's on the shelf, it's yours for free, all your supply, whether blood pressure medicine, cholesterol medicine. And you know what? It's not me. I'm just passing on. God provides and we deliver in Brooksville Cardiology. I'm just passing on what we got. And we got very good crew of pharmaceutical industry and so on, who believe that, hey, you got to be kind, really. You got to have this because it's, and this is good on the human part, that we feel the people, we feel the pressure, we feel it's tough times, and we try to help out to ease that pain. And maybe because it's either food or medicine. It's either like around the holidays, we have massive cancellations because people can't afford, the co-payments because they have to buy a gift to grandson or so on. And we understand that, and we're very sensitive about it. And we try to give everybody hope through discounted, medications. We have even one of the pharmacies is going to give $3 generics that we're going to be business partners with them. Anybody who wants to help us to give a good service will be a business partner of Brooksville Cardiology, and it will be basically instant, benefit to the patient. And if you want to go and have a T-shirt, Gus will give you 10% because he's my brother, right, Gus? Okay, you got the first business partner, yeah. So, yes, ma'am.
I just want to ask a question. I'm over 65, so I wouldn't qualify for this. But it sounds like a wonderful program. But do you know, is it just in Hernando County that this is now?
I'm starting in Hernando. Sure, I'm starting Hernando and Wesley Chapel office. This is just,
Just here.
That's the beginning. And may God help us.
The beginning, okay.
Just the beginning.
My family would be very
Anybody grandchildren, neighbors, say, God, you're struggling with, your premiums, you can't afford it, this and that. I heard something, and boom. It's old-fashioned way combined with technology. What's this here? Our mission statement. Everybody should be, if it goes into your mind, it stick in your mind, when we're done, is dedicated to providing a community with comprehensive, compassionate cardiac care, combined with cutting-edge technology and old-fashioned values close to home. We're trying to make it nice, close, friendly. We have the best of everything. We have the most sophisticated technology. We have all national accreditation. We have all that. Now we just need the patients that will fit into that, and that will cut down all the stress on the staff. The staff really, and I feel them, and I don't know what to do. You give everything by the book, and all this, but say, doc, even after first you have to struggle to get on as a provider, and then when you get on provider, then you don't get patients. When you get patients, you don't get paid, and when you get paid, it's peanuts. It's like so. This cycle most likely is going to get worse, given all the parameters that we see the economy. It's going to get a lot worse before it gets better. And while at the same time you need a relief now, so this may be a bridge to help people to the whenever that relief is going to come. I don't know. And we take one day at a time. We said to the staff, God, I tell them, God provides. He always have, He always will. Don't panic. You see the trees, the birds on the trees? Do you see the birds complaining of an anxiety or, they need Xanax or anything like that? They get up, they have empty stomach, God provides for them, they come at the end of the day full stomach. If we have faith in God, He'll provide for us like He does for them. And that should be the message that we should, try to hang in there, have faith in God, do the best we can. And that's what we're doing. Do the best we can. Get the word out. Let people know there's hope. There's another new little thing that's coming around, and I think it's going to make a huge difference. It's not for everybody. It's only for those between 30 to 65. And, for those who would like to you have more information, you have the website. You have the, for those who are in Hernando and our office in Brooksville, there's also another satellite in Wesley Chapel. And basically, we're open, enrollment all year round. Yes?
How many more doctors are involved? Is you or there are other doctors?
That's it. I said yeah. We hope that we.
Like in Pasco County and that?
Yes, it's not month by month. It's a 1 year because you cannot make ends meet. You've seen the package. You cannot, it has to be to cover, you could do the whole year. You can do 1 month to month, but it has to be 1 year commitment to really make ends meet. Because you've seen all the package, and that's it. It's not really making anything. It's just breaking even and keep things going. More important than really, making any kind of profit. Yes, sir. This is Ahmed, by the way, the father of Ahmed, who was here, who was doing here he is. Give him a big hand. Yes, sir.
My question, but I do have a friend of mine and his dad gave this information from the office. He couldn't make it tonight, but he gave me this question to ask. The son says he has insurance and he would like to enroll in this program. Does he have to cancel his insurance or not? Is number one. Number two, the dad is 65 and he has HMO. And again, he said, can he keep his HMO and enroll in this program? And they are both asking about the black seeds. They are taking medication now. It is interfered between the black seed and the medication they are taking.
Okay, 3 questions. Okay, very good. For the son, he can he will be enrolled in this hybrid, production, which a lot of people are unhappy about what they have because they pay so much money and they don't get anything. Although, quote unquote, the insurance, and I give you an example of my own. So, I believe if he's from that category, 30, 16 is relatively no major issues, I think he will benefit and he will have, if he worries about hospitalization or if he ever needs that, he will be carrying only a catastrophic kind of insurance that cover hospitalization only. But that's only a small proportion of what he pays the other one, the big one, the regular insurance. And for us, it's a health care, health maintenance plan. It's not insurance, it's a plan that makes people healthy. So he can enroll, no problem. He have to make that decision on how it is. Somebody said, well, they're not going to get you out. I'm not getting anything out. And can I make it? He'll be able to, all this question, I think, will be able to handle, discuss it with the staff, and they'll be able to guide them. I may not have all the answers to all the questions. The 65 we cannot buy, because of HMO, that's a separate entity altogether. I have no problem with that. But this is if somebody have insurance and you want to come, absolutely. If you want to come self-pay, you want to come,